So altogether, so far, what we've seen is a very coordinated response. But, you know, coming up are a lot of very difficult decisions, essentially at some points quite political decisions about difficult trade-offs between public health and the economy. And so it's possible we might see more divergence as we come out of lockdown.
And are there circumstances where diverging policies will make sense?
Absolutely. So as Ian Blackford just mentioned there, a lot of the scientific advice that is given to each government is very similar. The chief medical officers work very closely together, and the devolved administrations either kind of attend or participate in SAGE, which is the main advisory group. So the advice on the steps to be taken to lift lockdown is likely to be similar, but when those interventions are taken might be different. Ian mentioned again there that the R rate is the thing we've heard a lot about the kind of rate of the spread of the infection is currently higher in Scotland, Wales and Northern Ireland than it is in England, or at least in parts of England. And so it may make sense to take those steps at slightly different times. And I think that's what the Foreign Secretary was referring to earlier in his statement, to say that there's still a UK-wide approach, but it might move at slightly different speeds.
But what Nicola Sturgeon seems to be concerned about is the overall messaging and the possibility of diluting that.
Absolutely. Communications is going to be a huge part of this going forward, especially if we do see divergence. So already there's been quite a lot of confusion when announcements have been made by the UK government about whether they apply UK-wide or only to England. So example here is where the UK government announced a business rate holiday, and there was confusion in Wales as to whether that applied there. As we are potentially going to see more divergence, all of the governments need to be much clearer about communicating where measures apply, and also why, because there's a slight risk that if we see restrictions being lifted in different parts of the UK and people perceive that as unfair, they don't understand the scientific reasoning behind that, then there's a risk that you might lose public consent for certain lockdown measures, and potentially that could lead to problems with compliance.
Jess Sargent from the Institute of Government, thanks very much. Well, fresh from his first PMQs with Boris Johnson this week, the new leader of the Labour Party, Sir Keir Starmer, has been taking part in a series of virtual Meet the Voter sessions. Someone in his position would normally be racing around the country pressing the flesh, but he's having to zoom around on Zoom instead. Well, this afternoon he was holding one of these meetings with voters in Glasgow, and World Tonight's Paul Moss went along virtually and sent this report.
I just thank everybody for coming on the call and for your time today.
He called it a kind of town hall meeting. 150 or so people in Glasgow, all brought together by the power of Zoom to meet the new Labour leader, Keir Starmer. No coffee and biscuits beforehand, no going to the pub afterwards. This is how politicians have to connect with voters in a time of COVID-19. And the need to connect with voters is a pressing one for the Labour leader, as he himself acknowledged.
Certainly in the last election, I felt quite strongly that people wanted change, but they didn't trust the Labour Party to deliver the change that was needed. That's why meetings like this are so important, because in the end, I think, trust isn't an on-off switch. You've got to earn trust, and listening is at the heart of that, which is why I'm doing these sessions.
It didn't always make for pleasant listening. Perhaps participants were emboldened by the fact that they weren't confronting Keir Starmer face-to-face, just through the onboard camera of their laptops. Either way, Labour activists like Zara Maria Henderson told her party leader in no uncertain terms what they were up against.
We had a lot of people that felt that they just had no confidence in the Labour Party as a whole. And basically what I really wanted to know was what Keir's plan is to, first of all, gain back the trust of these voters.
Keir Starmer kept explaining he wasn't there to preach his own solutions, more to use the power of virtual meetings like this to hear their thoughts.
Good leaders listen to what people are saying to them, and they're going to keep on doing this. They're going to be out every week doing these sessions. Listen, listen, listen. And yet we've spent recent years...
It is odd watching these sessions on a laptop, because we're all used to watching something on a screen while it's actually happening elsewhere, like a political event perhaps. You have to keep reminding yourself that what you're looking at is the event. This is a virtual meet-up, so what's on screen is all there is. Keir Starmer is not sitting somewhere meeting potential voters in person while the rest of us watch. And some of his Conservative opponents think that limitation has put the new Labour leader at a definite disadvantage.
Politics, by definition, is reliant on personal interaction between individuals, between groups of people, and So for Keir to establish himself right now as the newly elected leader of an opposition is incredibly difficult.
Andrew Bowie is the Conservative MP for West Aberdeenshire and Kincardine.
Keir is in a position as a newly elected leader where people outside the Westminster bubble might not be cognizant of him, of his position, of his politics, of his personality. And so trying to make your mark in the public consciousness is incredibly difficult at the best of times, made even more so by the fact that the element of being able to go out there, press the flesh, engage with individuals is taken away completely.
That's a suggestion I put to Ian Murray, Labour's shadow Scottish Secretary. He actually worked in new media before becoming an MP, helping to start up an internet television station. And he doesn't buy the idea that having only online communication is necessarily limiting.
Let's not forget the power of doing some of this stuff virtually. Angela Rayner and Keir Starmer did a virtual meeting last week with young people. There was over 1,000 people on it, and they did Labour Party members the week before. There was over 3,500 people on it. It's very, very difficult to get that volume of people into a room at any one time in any case. So when we come out of this crisis and you are able to start meeting again, if you're able to augment that with the kind of technology that we're all now learning to use rather in our day-to-day lives, then I think that will be a really good benefit in the long run.
We now come to questions to the Prime Minister.
We are all having to get used to politics being practiced differently. Even the sacred theatre of Prime Minister's questions now includes MPs asking their questions remotely.
How will the Prime Minister fulfil that funding promise and not return to the dark days of austerity?
Well, Mr. Speaker,
It's been said that the coronavirus outbreak is accelerating change that was already underway, as people find new ways to operate in business and education, for example. But politics too will be permanently altered by the experience of lockdown, according to Hira Hussain. She advises companies and public organisations on how they can better use technology.
After politics is over, I think politicians will change. Online world offers a whole range of opportunities, which I hope that they have seen now. They can cut down on traveling costs. They can use it to reach audiences that they haven't been able to reach before, whether they're remote or it's because they can't travel to go to those meetings. Our politics has been stuck in a very old time, and it hasn't caught up with where the rest of the world is in terms of connecting with people. And I hope that this brings in a new era for politics.
Hira Hussain ending that report by Paul Moss. The anecdotal evidence has been there for some time, but today the Office for National Statistics put a figure on the increased mortality of COVID-19 patients in England and Wales who are from ethnic minority backgrounds. The picture is gloomiest for black men, who by some metrics are 4 times as likely as white men to die from the disease. Strip away other factors such as age, health and levels of poverty, and black men and women are still almost twice as likely to die from coronavirus than white men and women. People from Pakistani and Bangladeshi backgrounds also have much worse survival rates than white Britons. Well, it is a very visible problem in the healthcare community, with 60% of healthcare workers known to have died with coronavirus being from black and minority ethnic backgrounds. So what's going on, and what is the impact of this disparity? Joining us now is Dr. Vishal Sharma. He's a cardiologist and Deputy Chair of the BMA Consultants Committee. He's from an Indian background. Good evening to you, Dr. Sharma.
Good evening.
Well, what are members saying to you about all of this? How concerned are healthcare workers?
Yeah, they have been quite concerned. So as you mentioned, I think people have felt that this has been the case for some time, but these figures really have confirmed that. And there has been this anxiety that's been growing in the background about what it means. And I suppose more importantly, why this is actually happening and what you can do about it. And so people are a little bit anxious about this, and rightly so. The NHS is now taking this very seriously and is starting to risk assess its staff. But I think we need to start moving on with that process so people can feel a bit more reassured and potentially move out into different roles where necessary.
And on that first question, why? Too soon to give any concrete answers?
Yeah, absolutely. It's too soon. This is obviously a new virus, and we're learning all the time with this. There are a whole host of possibilities that people are looking into. I think it will take some time to tease them all out. As you mentioned, when you strip away the kind of age and socioeconomic factors that the ONS did today, there's still something driving this. And I think trying to work out what that is difficult. And there may well be some social factors that have not been accounted for. There may be some cultural factors, and there may even be some medical factors as well underlying all this.
So on the risk assessments, you're in favour, are you?
No, absolutely. I think it's now fairly conclusive that there is an increased risk, and this is something that needs to be done for this particular group, but also those with other health conditions as well. And it's a combined process because, unfortunately, many people who are from this black and minority ethnic groups also have health conditions, and their risk is even higher.
So, what should happen as a result of the risk assessment? Should it still be down to the healthcare workers themselves, though, to make the decisions about whether or not they want to stay on the front line?
So this really needs to be led by the employer. So the employer's got an obligation to look after its staff, first and foremost. So I think that there will be a bit of a two-way process around this. But I think wherever possible, if people are deemed to be at high risk, they can potentially move to sort of non-patient-facing roles in some cases, or just their jobs modified very slightly so they're not at the highest risk end of dealing with patients in particular procedures, for example.
There are tricky knock-on effects of this, though, aren't there? Which is that, for example, others not from these backgrounds would have to come into potentially hazardous positions, and perhaps they might not want to.
Yeah, and I think what we mustn't lose sight of is that this needs to be equitable as well, and there are people of all backgrounds who have health conditions who are also at increased risk. So I think we shouldn't prioritise one group over another, and actually I think you need to look at risk for everybody, and this is one risk for this particular group, but we mustn't lose sight of the fact that other groups have risk factors related to age or health, for example.
Are you confident that this situation, though, can be brought under control?
In terms of the risk assessing staff, I think that's certainly something we can do. I think it's important we do that quite quickly, because obviously hopefully we're coming towards the sort of tail end of the first surge now, and we're looking at sort of bringing what other services back online again. I think before we start doing that in large numbers, we need to make sure we've got enough staff available in key areas to make sure we can do that safely.
Dr. Vishal Sharma, Deputy Chair of the BMA Consultants Committee, thanks very much. Now, from cancelled GCSEs and A-levels to unequal access to home computers and broadband, there's plenty of concern about the impact that school closures are having on children's education. Certainly these girls from North Wales are missing being at school, as they told our education editor Branwyn Jeffries on Tuesday.
Hi, I'm Whitney, and I'm getting on quite fine, but my English is the hardest because I got a booklet and I'm not sure what to do with it.
I'm Amy, and I miss school because I miss seeing my friends and my teachers and just doing work.
So how does the lack of textbook guidance compare to the impact of being apart from their friends? Well, many child mental health experts believe that for younger children in particular, playtime should be prioritised over purely academic considerations when schools reopen. Well, joining us now is Helen Dodd, Professor of Child Psychology at the University of Reading. She's one of the experts in children's mental health who's written to the Education Secretary, Gavin Williamson, today. Good evening to you, Helen.
Good evening.
What do you think? You believe that play really needs to be at the forefront of priorities?
Yeah, so I'm part of a group of mental health experts who, as you said, we've put together some evidence and some recommendations that we've sent to ministers this week. And what we really want to do is to highlight that children's social and emotional well-being needs to be a priority. It needs to be considered. It needs to be on the table when decisions are being made about how long lockdown goes on for, about easing lockdown. And what we advocate for is that social and emotional well-being needs to be considered, and that children really need social interaction. When they do eventually go back to school, whenever that might be, it's going to have been a long time since they saw their friends, and the expectation that they might go back into school, sit down in the classroom and immediately be ready to learn is just not realistic. So what we want to make sure is that they're in the right place emotionally to be ready to re-engage with their learning.
But what about the place that they are in physically? That phrase that has become one of the phrases of the pandemic, social distancing, that's still going to be a requirement, isn't it, in some form or another, and it's very difficult to see how it can be maintained in the playground.
Yeah, I mean, it's going to be very, very difficult for children to be together and be expected to stay 2 metres apart, especially very young children. And we really need people who are making the decisions to be thinking about that, to be thinking about what is the effect of that going to be, how realistic is this, and how are we going to manage it in a way that we make sure that it's not too distressing for children. And so what we're advocating for is that children need an opportunity for social interaction, and they need an opportunity for play. And that should be factored in however that might happen. So even if it means they go out in just 2s or 3s on a kind of rota basis to play on the playground throughout the day, they need to have that playtime and that opportunity for social interaction.
I just wonder, given how many kids use mobile devices, have access to them, and presumably have been able to FaceTime their friends with their parents' help, have they not been getting some of the interaction that they might be missing out on?
Yes, definitely. Particularly older children are able to get some of that social interaction, and at the moment that's definitely something we would encourage parents to be doing, is to support children who want to do that, to engage with their friends socially that way. But younger children, that's very tricky for them, and some children find it quite distressing to see their friend on the screen but not be able to interact with them in the normal way. And young children don't have conversations like we do as adults. They don't kind of turn-taking conversations, so it can be quite an artificial social interaction for younger children.
Dr. Helen Dodd, Professor Helen Dodd, thanks very much indeed. Now, another 3.2 million Americans have applied for unemployment benefits over the past week, taking the total number of jobless since the pandemic began there to more than 33 million. Just 2 months ago, unemployment was at a 50-year low in the United States. Social impact of these mass layoffs is already being felt, and our New York correspondent Nick Bryant spent the night on the city's subway, a refuge for the poor and the vulnerable.
Midnight on the New York subway, and many of the city's homeless are bedding down for the night aboard its empty carriages. By day, the subway has become a virtual ghost train. Daily rush hours, a thing of the pre-pandemic past. But by night, it's become a mobile shelter. In the first 5 carriages we went in, we found people trying to catch some sleep, stretched out on the uncushioned seats, slumped against the windows, their few possessions in carrier bags beside them. Many are the newly unemployed, some labourers who used to rent rooms by the week, but no longer have the cash to pay their landlords. The coronavirus homeless.
A lot of homeless people are afraid to go to the shelters because there are so many people there sleeping in such confined spaces. They're worried about catching the coronavirus. Instead, they're taking their chances on the subway.
The subway could hardly be described as safe. More than 100 members of staff on New York's mass transit system have been killed by the coronavirus.
Last stop, all passengers exit the train, please. Last stop, train is out of customer service.
This week, New York did something it's never done before. Conducted a planned overnight shutdown of a subway system that has always operated round the clock. It meant the NYPD evicting the homeless so that the carriages could be disinfected. Here a young man was gently escorted off the train, phlegm dripping threateningly from his open mouth.
Would you like a mask? It's the last stop, you have to step off.
In another carriage, an elderly woman who didn't speak much English and who didn't seem to have any idea of where the train had just drawn to a halt was told she'd have to get off.
Do you have a shelter or English? 34th.
City officials were on hand to offer shelter. Volunteers offered guidance and money.
We're $50 in any stores at all.
But those woken in the middle of the night were confused, disorientated and fretful. The homeless have been amongst the vulnerable in this, the worst affected city in the world. And over the weekend, 2 homeless people were found dead on the subway.
There's much higher incidence of heart disease, hypertension, diabetes, COPD, and other respiratory illnesses.
Dave Giffen of the Coalition for the Homeless says COVID-19 has made an existing crisis much worse.
Homeless people right now in New York City have a 50% higher mortality rate from COVID-19 than do house New Yorkers. So by not offering people just something as simple as a hotel room where they can go and be safe and safe isolate, we're really relegating them to die.
You guys gotta remember, yellow line.
Almost 100 years on from the Great Depression, it feels like we're living in another time of buddy, can you spare me a dime? And just as the face mask has become the global symbol of this viral contagion, queues outside food banks and modern-day soup kitchens have become the marker of the economic convulsion.
Let's go, brother!
Here the wait was for lunch at a shelter in Lower Manhattan. But it's not just the homeless anymore who are lining up, says James Winans of the Bowery Mission. It's the newly jobless as well.
I've spoken with folks on this line who at the beginning of March were employed and now they're unemployed. and they're trying to figure out how to make ends meet. And so part of how they're doing that is to stand on this line at the Bowery Mission, pick up a to-go meal, and make ends meet that way.
It's now the early hours of the morning on the New York subway, and some have turned down the offer of emergency shelter. They leave the station and walk off into the night. Poverty has been a propagator of this pandemic. Hardship has been a super spreader. And for many, the phrase that best describes the exuberance of New York, the city that never sleeps, must now sound like a taunt.
Nick Bryant reporting. Summer holidays may not be top of our agendas at the moment, but there are plenty of countries whose tourism industry wishes we were there. Damien Grammaticus reported from one of them on the programme last week.
In Benidorm City, we're now 20 floors up. This is called Planta 20, a bar on top of the Hotel Madeira, and looking out over the empty town. All the streets that radiate out below are deserted. The hotels that line them are totally empty. The beach down in front of me, which stretches around 2 big curves of golden sand, is beautiful, but also empty. And this town was built for tourists. All of the income here comes from tourism, and that has completely ground to a halt.
Benidorm, just one of the many tourist destinations facing some dark economic clouds. But some European countries are now thinking about ways of resuscitating this year's holiday season, with Germany making an early bid for the beach. Yesterday, the German Tourism Commissioner Thomas Bareis said that his government was in talks to create Corona corridors to neighbouring countries, potentially allowing Germans to drive to the French Riviera or for Poles to take the train to Berlin. He hinted that deals like these could even be struck with more far-flung destinations such as Greece or the Canary Islands, as long as they had low infection rates. So is this the way forward for opening up tourism in Europe? Well, earlier I spoke to Tom Jenkins, Chief Executive of the European Tour Operators Association, and José Ramón Bauza, a Spanish member of the European Parliament who used to be president of Spain's Balearic Islands. He told me what impact the pandemic has had on the islands.
Our GDP depends almost completely on tourism. There are hundreds of thousands of jobs that are going to get lost, and millions of euros in losses that are going to affect just this season, but also the following one. I can tell you, as a former president of the Islands, for us it's an absolutely dramatic situation, because the season has finished even before it started.
So when you hear the German Tourism Commissioner suggest this idea of Corona corridors, of Germans in the first instance going to countries that might be safe, where infection rates are low, does that fill you with some encouragement?
Yeah, I couldn't believe that an authority said that, because what they are doing is just to divide. What we are doing right now is to find a common approach to fight against the coronavirus. And in tourism, this common approach will transform into giving both safety and confidence to tourists to travel. No one is going to travel if they think that they are going to be infected. So we need to assure that there are common standards among Europe that countries must fulfill in order not only to keep confidence, but also to keep them safe.
Let me bring you in at this point, Tom Jenkins. What do you make of that objection? Do you also think there needs to be a common approach, that bilateral deals, if you like, of this sort won't work?
I think that the situation is so dire in the tourism industry in Europe that the situation can only be alleviated by a common approach. And I think the European Commission, which has been largely sidelined by the nation states in Europe doing their own thing, will start to step up and start to try and coordinate. I suppose the point Germany is making is there are not common levels of infection in all the European countries, are there? So in terms of safety of tourists, there are different standards. Well, we genuinely don't know at the moment, with respect to the German authorities. This is a pandemic. It is everywhere. But what we're having is a really critical damaging of the European economy, of which tourism is an integral part. And I think what we'll be looking at within the next 6 weeks is a dramatic lifting of restrictions. It's widely expected that the recovery in tourism will start with domestic tourism. And what the European Commission, I think, will be trying to do is ensure that the domestic tourism market within Europe is the Schengen area. It will be 500 million people. And this gives something for the tourism industry to tilt for.
So individual countries can't exist on staycations, can they?
No, they can't. In many cities, in the Balearic Islands, it's central importance. But even in towns such as Paris or London or Amsterdam, tourism makes up maybe 15-20% of the service economy. But if you're running a business and you lose 20% of your business is going critical. So the whole service economy of Europe is now in a coma and is likely to be revived fairly shortly. But if they haven't got tourism flowing through its veins, they're going to have real problems. And so you're going to need to have a really big, not a piecemeal, but a big restoration in confidence somehow throughout Europe. Otherwise, we're going to be not in a recession, but we'll be in a depression.
Jose, if the Germans go ahead with this plan, what do you fear?
I'm sure they can go ahead. We need to show tourists that Europe is safe, whenever it's going to be safe, that there are criteria that they can trust and that the EU is going to take care of them. We need to work together in order to give confidence to the tourists. If we don't do that, we will lose not only this season, we will lose even the next one.
Tom Jenkins, you talk about Schengen essentially being one space, considered as one space. But what about tourists coming from outside Europe? How important will they be for the European tourism industry this year?
Well, I mean, they are rather like tourism in the whole of the service economy. They are a vital 10 to 15% of the European tourism economy. And one of the problems we've got with the idea of COVID corridors is that it means that Europe is going to be opened up on a kind of piecemeal basis, which really isn't a product we can sell in America, China or Japan. I mean, we need to have Europe as a single destination.
Why not? Why don't the Chinese and the Americans go to certain European countries rather than others?
Well, they do, but they see Europe as a unitary destination, albeit with the UK as a sort of appendix. But they buy Europe, and most of them visit more than one country.
Can I ask both of you whether when you look ahead at the summer season, whether you see cause for optimism? Do you think, Jose, that there will be tourists back in the Balearics over summer?
Yes, and I have proposed something called Brand Europe, so that Europeans know that they can travel all around Europe and that this summer is the perfect timing to discover a safe and, of course, a wonderful EU. Our economy needs this desperately, and our tourism sector is ready to receive Europeans.
Tom Jenkins, how optimistic are you about the coming season?
I'm surrounded by pessimists. I'm delighted to hear Jose being so optimistic. I think from an inbound point of view, Europe selling itself as a destination throughout the world will be very lucky to see any significant arrivals from outside of Europe, from America, from China, from Japan, much before September or October. And I have plenty of people thinking that will not start moving before 2021. In terms of intra-European traffic, there is everything to play for.
And that was Tom Jenkins, Chief Executive of the European Tour Operators Association. We also heard from Jose Ramon Bauza, former President of Spain's Balearic Islands. That is The World Tonight. This is James Kamara Sami. For now, from me and from everyone on the programme, good night.